Hello and welcome to another of the eBiology Teacher Podcasts. I'm Mr. Doc, and today we're doing immunology and pathology. Really, what that means is what happens to us when we get sick, and how does it cause it, and what is our body really doing. And hopefully by the end of the lecture, we'll get to know that sick is actually your body telling you it's doing its job. That's really what's happening. So when you get sick, it's not that necessarily that something is quote unquote wrong. It means your body is responding, hopefully, the way that it should. So let's take a look at our objectives. Here's what we hope to accomplish today. First off, we want to describe how bacteria and viruses cause disease. Now, we're going to be sticking primarily with mammalian, more specifically human anatomy. So we'll kind of keep humans sort of in the forefront here. We'll be able to explain the difference between lysogenic and lytic viral infections and how they're connected, how they're different. We'll also explain how to prevent viral and bacterial infections, what we can do to prevent them from happening, and we're going to explain how your body's going to react to an infection. Now, let's be clear. This lecture is about diseases and disorders that are caused by what's called a pathogen. That's something that causes a disease. It's typically something like a virus or a bacteria. It can be fungal, that sort of thing. Some protists are pathogenic. We're not talking about diseases or disorders that are encoded in our DNA. We would have talked about that earlier in our genetics unit. So let's talk specifically about what our body's immune system does when we're exposed to those sort of pathogens. All right? So let's start with, why do we get sick? Well, an organism or a substance that causes a disease is known as a pathogen. Okay? Now, disease occurs when a pathogen gets into our body and causes some sort of conflict, some sort of problem. Now, pathogens, as I mentioned earlier, can be protists, they can be bacterial, they can be viruses. There are proteins called prions, or protein-like particles called prions that can cause them. So there are a variety of different things that can cause us to get ill. Pathogens is the generic term that we use to describe the thing that causes the conflict or the thing that causes the illness. So if we look back and we say, well, let's consider HIV, for example. Well, the pathogen for the disease is the virus HIV. The disease is the acquired immune deficiency syndrome. So one gets a pathogen infection of the human immune virus. Then they contract the disease that's associated with it. If you get the flu, which might be a better example, you have an influenza virus infection. All right, the pathogen is the influenza virus. The disease is the flu. All right, and that's sort of what you end up with. Now, when we look at how this happens, how all this stuff works, it's important to know how things are exchanged. So we're going to show you a little video real quick of just how easy it is for these viral or even bacterial particles to exchange. All right, and this is a little cheesy, but remember that germs are everywhere. Some germs are viruses, some germs are bacteria. Some germs live in the air, be when we sneeze. Some germs love conditions where it's warm, wet, and dark. That's where germs divide and multiply best. So the story you're about to see is true. Only the bacteria have been changed to appear less scary. They've been given eyes and they sing a little bit when they multiply, so relax and enjoy. Keep in mind, this is happening all around you. This is the sneeze, how germs are spread. Those are bacteria. And the sneeze. Okay, just kidding.
Hello, would you like some donuts?
My favorite, glazed donut. Oh, my candy donut. Oh, no, chocolate. Oh, but I want a diet. Oh, well, I'll just have an itty-bitty bit.
Okay, that lady's just gross, but whatever.
Oh, where can I wash my
Hopefully you
hands?
get the idea,
Down the hall,
right?
that way.
Thank
Hold
you.
on. Okay. I think we get the idea. All right. So that's how they spread. I mean, it can be as simple as that. It can be airborne. They can be in contact. There's dozens of different ways in which pathogens can spread. So there has to be a way to prevent it, and we'll get into that here in just a second. But let's get back. Bacterial diseases usually disrupt equilibrium by interfering with the way the body normally functions. All right. There are typically two ways in which this happens. Bacteria can get in and basically act as decomposers to cells and tissues. So basically, when they get into your body, they treat your living tissue as their food and they decompose it. They break those cells down and they break those tissues down and they use them for their own food. This is kind of how tuberculosis works. An equally common way in which bacteria interrupt our body is by releasing toxins that interfere with normal function. So they end up causing the cells to either misfunction or stop working and die altogether. Strep throat is caused by a bacterial infection of streptococcus, and this is how that works. So the streptococcus bacteria release a toxin that interfere basically with how the cell typically functions. Now, non-living pathogens, on the other hand, can interrupt the body's equilibrium, but they do so in a different way. Most times, viruses are specific regarding the cells they attack, which means that they can't really attack a different body system. So, for example, polio viruses, they attack nerve cells. HIV virus, or the HI virus, attacks white blood cells and immune cells. So they're typically specific, not unlike an enzyme and its substrate. The reaction is very similar because you have little sensors on the outside of your cells, and they have to match. Right, so that's why a virus can get into, say, a white blood cell. HIV can get into a white blood cell, but doesn't affect red blood cells because red blood cells don't have those on their cell membrane. All right. Viruses attack the cell by injecting their genetic material into the cell and then basically hijacking it. Okay. And basically, what happens is viruses are tiny particles that have a protein coat, which we've talked about in our taxonomy unit, and they have some sort of genetic material. And that genetic material is injected into the cell and then makes the cell kind of follow its own direction. Now, there are tiny particles that act as pathogens called prions, and they basically form the disease by causing protein clumps. And hopefully what we know by now is that protein determines structure, and structure determines function. If you didn't say function, shame on you. You know what I was going to say anyway. But you get the idea. If we put in proteins and it causes the proteins to change shape, they're going to change function, and that's not going to work. An example of a prion-based disorder would be bovine spongiform encephalopathy, which you know better as mad cow. Where's my mad cow? My cow is gone. I had a mad cow around here somewhere, and he's gone. That makes me sad. Anyway, I'm distracted. Moving on. Viral infections work in two ways, either lysogenic and lytic, or just lytic? Here's the long and short of it. During the lysogenic cycle, a viral DNA or RNA basically gets inserted into the cell's functional DNA. Then the cell itself reproduces, thus causing that viral DNA to be replicated as many times as the cells themselves divide, right? So basically, it's making cells that are making more cells that have the information in them. Then, when the cell acts on that little piece of DNA, it starts making more viruses, and it doesn't stop. During the lytic stage, the cell is infected and begins to produce more viruses with that genetic information, and the cell eventually bursts or lyses, and we end up with thousands, if not millions, of viruses just being exploded. So basically what happens in the lysogenic cycle is the virus injects its DNA or RNA, which becomes part of the cell's normal functioning. That gets copied through the process of DNA replication and gets passed on to each of the cells that come from it through the process of mitosis. The lytic cycle basically inserts the DNA and produces more viruses. Now, some viruses start lysogenic, work their way through, and then become lytic. Other viruses are simply lytic viruses. So, for example, something like HIV, which we've talked about already, is going to be a lysogenic virus. It's going to inject its material into the cells, which explains why you could have that virus in one's bloodstream for a long time and never see the symptoms of the disease, because it's lysogenic. It's just laying in cells, laying in wait until it becomes lytic. And when it becomes lytic, it starts destroying cells. And in destroying cells, because it's so full of viruses, it's not only destroying cells, but it's throwing out viral particles that are going to go and destroy other cells. And it just becomes this sort of cascading effect. So the question is, why do we get sick from viruses? Well, it destroys cells. When the cells stop working, we stop functioning properly. It's kind of simple, but it's the way it works, right? So the question is, how do we prevent disease? Well, if you're infected with a bacterial disease, it can be treated by a substance called an antibiotic, which is a compound that blocks the growth and reproduction of bacteria. Now, too many antibiotics can lead to resistant bacteria, and this takes us all the way back to discussing evolution. All right? Antibiotics, once again, are compounds, medications, for example, that basically keep bacteria from growing and reproducing. And the name comes from anti, meaning against, and bio, meaning life. Now, the reason why overuse of antibiotics can be very dangerous is because when we use an antibiotic, we only kill those bacteria that antibiotic can kill, which means that the ones left over, the antibiotic didn't have an effect on. Well, now they don't have any competition, so the ones that were resistant to the antibiotic are going to grow and reproduce. And now we got to get a stronger antibiotic to kill them. Well, there's not going to be a 100% kill rate here, so there's going to be a little bit that are immune to that. And then those organisms are going to grow and reproduce. So over time, what we're really doing is forcing bacteria's hand. We're forcing evolution to occur, and the bacteria are becoming more resistant to the drugs that we have. And some people would argue that they're becoming more resistant, or they're becoming resistant faster than we're developing new medicines to treat them. And there are some cases of that where we have like drug-resistant staph infections, where people get in the hospital and they have a bacterial infection, which would typically be treated by an antibiotic, but the antibiotic's not doing its job. The antibiotic's not doing the trick. All right? Viruses can't be treated this way. Let's see if we can figure this out. If antibiotic means against life, why can't we use that for a virus? Because they're not alive, right? They're a non-living particle. An antibiotic won't affect something that's not living, right? So viruses, and in some cases bacterial diseases, can be treated by vaccines. This basically puts your immune system to work for itself. A vaccine is simply a weakened or killed version of a pathogen that allows your body to get used to dismantling it or destroying it before you actually get sick with it. All right, I'm going to say that again. A vaccine is the introduction of a weakened or killed form of a pathogen that allows your body to get used to it so that when it is faced with that infection, it knows how to fight it. My analogy, it's like boot camp. Okay, if I'm sending troops off to war and they're going to Afghanistan, right, in the desert, I'm not going to train them in jungle warfare, right? I'm going to train them in desert warfare. So by introducing this pathogen, I'm sending it to my body and I'm saying, hey, this is the thing you're going to get introduced to soon. Learn how to fight it. And that's what our body does with a vaccine. We get an injection and it's the weakened form of the virus and our body's like, okay, I think I know how to do this. Then come the flu season where we get the flu virus. Our body's like, I recognize you. I know how to fight you. Boom, you're out. And that's why we don't get sick when we have a virus. It also explains a similar reason why if I get a viral infection that my body's able to overcome, I typically can't get it again because my body knows how to fight it. I've had chickenpox before. I get it. I know how to do this. So when you're exposed to chickenpox the second time, your body's like, don't worry about it. I know what to do. Right? All right. So the human immune system is equipped with a variety of defense systems. We really separate them into two. We have primary defenses, which basically prevent things from coming in. And then we have secondary defenses, which fight them if they do get in. All right. So we've got primary defenses, which is kind of like the walls, right? We can't get through there, right? But if something does get through, our secondary defenses are active fighters that deal with things that do make it past our system. So our bodies are like a fortress, right? Our skin is that primary defense. It keeps pathogens out because they can't penetrate it. Oils and sweat create an externally acidic environment. A lot of pathogens that come in contact with skin, oils, and sweat will be killed because of the acidity, and in some cases because of the salinity or salt. Mucus inside the most openings of the human body actually trap pathogens that don't allow them to get into the bloodstream. So our nose and our mouth, for example, have mucous membranes that basically trap pathogens that prevent them from getting all the way into our body. This is a great thing, and we don't realize how often those mucous membranes and these external defenses help us out. There are some people for whom this doesn't work very well, and they're sick all the time because these systems just don't hold things out. All right? The guards create what's called an inflammatory response. So when pathogens do make it through the skin, white blood cells called phagocytes leave blood vessels and they go into the tissue and they basically eat the invading bacteria or pathogen. This results in inflammation. Okay? Inflammation we perceive as usually a warming sensation. It hurts. A lot of times inflammation is going to turn red. Okay, so if I get cut and I get bacteria in that cut, that part of my skin is going to turn red. That's an inflammatory response. Basically, it's raising the red flag and go, hey, we've got a problem over here. So those white blood cells are going, and they're going to be that first line of defense past our skin. Something gets in, okay, this is not cool. The white blood cells are going to, the phagocytes specifically, are going to start to eat that up and try to do it, and that's going to create an increase in blood flow, which gives us an inflammatory response. So if you get a cut on your arm and it starts getting red, that is an indicator. Your body is telling you, hey, something's wrong here, right? But the inflammation itself is an indicator that your body is doing exactly what it's supposed to be doing. That inflammatory response says, I'm on the job, at least, right? Then a lot of doctors will point that out to you if you're allergic to something. They'll say, I understand you're a little concerned about this, but this is your body telling you it knows what it's doing. All right. Now, if we go further past this, we get into our body's personal army. If the pathogens get through our primary defenses and the inflammatory response and what comes with it, the phagocytes, aren't able to completely deal with it, this will trigger an immune response. Okay, any pathogen that triggers an immune response is called an antigen. And basically, it's part of the pathogen that we can find as a signal. Our bodies have what are called B lymphocytes, or B cells. And these B cells recognize specific antigens. Antigens, again, are the sort of flag we'll call it the uniform of a particular invader, right? When an antigen is detected, the B cells grow and divide rapidly to form plasma cells and memory B cells, all right? So if we have an antigen that is not recognized, our B cells grow and divide to form plasma cells, and we start to form what are called memory B cells. All right, I'll put that back up so you can get that. So really what's happening here is our body starts to see a new infection, and it starts to ask the question, I don't know what that is, and I don't know why it's here, but I need to respond to that. All right. The antigen basically triggers that. This is sort of reconnaissance for your body. The next step is that these plasma cells are going to produce antibodies that bind with the antigens. Now, these antibodies basically lace the target. Okay, antibodies are our body's way of flagging an antigen for destruction. So let's go through this in our head real quick. I've got a new pathogen in my body, and my body's looking at it like that doesn't look familiar to me. I don't think that's right. So the antigen is what we're seeing. Okay, I see that doesn't look right. So our body attaches an antibody to it. That's our way of saying, hey, that thing with the antibody on it, that's got to go. That's not good stuff. So our bodies are flagging all of these pathogens that have antigens on them with antibodies. And that's how our body's cells, our blood cells, are going to know what to attack and what not to attack. All right. This makes it easier for the phagocytes to destroy the antigens because the antibodies are specifically made for an antigen. Well, here's the thing. If I know how to make an antibody, the next time I see that antigen, I know what to do, right? So when my body learns how to make a new antibody, I get it to new bodies, right? Then it knows how to do that from now on. So if this infection happens again, if my body knows how to make the antibody, then the next time I get it, I'm good to go, right? Millions of memory B cells will remain in the body once the pathogen is gone and will be able to produce antibodies as necessary. So basically, the B cells are going to decrease the response time it takes to more quickly deal with antigens by associating them with antibodies and getting rid of them. Once an antigen is marked with an antibody, one of those phagocytes is going to come and gobble it up, and we're good to go. Keep in mind that vaccines introduce weakened antigens, which leads to the creation of memory B cells. So this goes back to what we talked about with vaccines. Vaccines introduce these antigens in a safer way. The antigens are not attached to anything that's going to make us sick because they're weakened or killed. But because they're in our bodies are going to treat them as a foreign object and are going to create antibodies to destroy it. Once it's done that, it will remember how to do that next time, right? So basically what's happening here, let's say we get a cut. Bacteria is going in there, it's starting to get affected. I'm going to see an inflammatory response. My phagocytes are going to try to work at it, but let's say it goes past that point. My immune response kicks in. I have these B cells that are going to come and they're going to form plasma cells and memory B cells, and they're going to recognize those antigens, and it's going to I'm going to produce an antibody specific for that antigen. The antibody's attached to the antigen, and it's like a big red flag where the phagocytes are like, I'm looking for the red flags. I'm going to eat that, I'm going to eat that, I'm going to eat that. And that's how our bodies deal with an infection. And of course, if we don't want that infection in the first place, we use a vaccine, and our bodies learn how to do that before we actually get infected. This does take us to a very quick note, and that is, well, why can't we just have a vaccine for everything? Well, some pathogens are so dangerous that we couldn't even introduce ourselves to a weakened form of it because it could still be cause us to be sick, or it could even be deadly. So there's no vaccine for HIV because any attempt at that would cause HIV. It would cause AIDS, and that's obviously not what we want. Let's review our objectives. How do bacteria and viruses cause disease? Well, remember, bacteria do one of two things. They either destroy the cells, basically decomposing them, or they produce toxins that prevent the cell from working in the first place. Viruses, on the other hand, introduce genetic material into the cell and cause the cell to follow those orders. The difference between lysogenic and lytic viral cycles is lysogenic inserts its DNA or RNA into the cell and makes the cell reproduce it. Then the lytic cycle basically causes the cell to become a virus factory, producing millions of new viruses, which end up destroying more cells. All right. To prevent bacterial and viral infections, one of the best things we can do is make sure that we destroy viruses and bacteria before they get into our bodies, right? But remember, viral and bacterial infections can be prevented by vaccines, which are basically weakened versions of the antigen or the pathogen itself that allow our bodies to go, okay, we're going to learn how to do this, how to destroy this before we actually get sick. So it's kind of like boot camp. And then we're going to reflect on how our bodies react to infections. Again, this goes back to that idea that we just talked about, how we have the inflammatory response if something gets past our primary defenses. Then our body produces antibodies that learn how to flag antigens, which can then flag phagocytes that can then destroy the infection. I hope you find this information helpful, and I look forward to discussing it in much further detail with you in class. So oh, sorry. You should probably go wash that. Oh, I'm so sorry.